Few things can ruin your day faster than a sharp zing in your tooth. You take a sip of your favorite iced coffee, zap, and suddenly you're Googling, "Do I need a root canal?" Don't worry, before you call the dentist and prepare your wallet, let's find out what's really going on inside that tooth. Welcome to my channel. Tooth sensitivity usually happens when your enamel, the tooth's armor, starts to thin, or your gums recede, exposing the dentin underneath. Dentin has tiny tubes that lead straight to your nerve. When something cold, hot, or sweet touches those tubes, it's like poking a nerve with an ice cube. Think of enamel as the tooth's jacket. Brushing too hard, you're basically sanding off its coat. Nobody likes to go out without a jacket, especially your teeth. Common causes of sensitivity include aggressive brushing, whitening products, acidic foods, gum recession, or even a worn filling. Usually, it's temporary and treatable, when it might be more serious. But sometimes, that pain isn't just a surface level issue. If your tooth hurts even when you're not eating or drinking, or if the pain lingers long after the trigger is gone, that might be a sign your tooth's nerve is inflamed or infected. Here are some classic red flags that point toward a root canal. 1. Throbbing pain that wakes you up at night. 2. Sensitivity that lasts more than a few seconds. 3. Swelling or tenderness in your gums. 4. Tooth discoloration. 5. Pain when biting or chewing, even without temperature triggers. If your toothache feels like it's keeping its own heartbeat, yeah, it's time to call the dentist. The root canal truth. A root canal isn't as scary as the internet makes it sound. The dentist removes the infected nerve, cleans the space, and seals it up. Modern root canals are about as painful as getting a filling, seriously. And here's the good news. Root canals actually save your tooth. Without it, you'd need an extraction and possibly an implant later. So if you've been putting it off, think of it as dental rescue, not dental doom. Besides, wouldn't you rather have a nap in the dental chair than a full-blown toothache at 2 a.m.? How to tell the difference at home. If you're trying to figure it out at home, here's a simple guide. If pain is only experienced with cold, sweet, or brushing, it's likely sensitivity. If pain lingers or feels deep, dull, or throbbing, it can be nerve damage. If you experience pressure or swelling, call your dentist. And if your pain stops only when you stand on one foot and hum the national anthem, that's definitely not dental science. Please, see your dentist. Ultimately, only an exam and X-ray can confirm whether you need a root canal. But knowing these signs helps you act early, and sometimes, early care means avoiding one altogether. Prevention and relief tips. To prevent sensitivity or nerve inflammation, use a soft bristled brush and gentle strokes. Switch to toothpaste for sensitive teeth. Avoid over-whitening. Limit acidic foods like citrus or soda. And never skip your checkups. Tiny problems can snowball fast. Remember, ignoring tooth pain doesn't make it go away, it just gives it time to apply for permanent residency. So next time your tooth zings, don't panic, just pay attention. If it's short and sharp, you're probably dealing with sensitivity. If it's deep and pulsing, your dentist might need to step in. Either way, it's fixable. You've got this. Subscribe for more no-fear dental tips and health hacks that actually make sense. Because your teeth deserve more than guesswork.